Let us discuss the liver in detail. This is the topography of the liver, the anterior view, the lateral view. See, it is exactly located below the diaphragm. The posterior view of the posterior topographical view of the liver. See, the liver is located in the right hypochondrium, epigastric, also in the left hypochondrium. Remove the anterior abdominal wall. Liver is exactly located below the diaphragm, so a part of the diaphragm along with the thoracic wall we are removing. So now we can see the liver, the entire right and left lobe of the liver. So this is what I am lifting is the diaphragm, the cut end of the diaphragm. The diaphragm is lifted upwards to show the liver clearly. That is the anterior wall attachment of the diaphragm. What we are seeing is the abdominal surface of the diaphragm. Okay, that is lined with the parietal peritoneum. So that's the liver. We can see the right lobe as well as the left lobe of the liver clearly. See that the parietal peritoneum getting reflected from the diaphragm and to form the falciform ligament. The other ligament also, the coronary ligament and the triangular ligament, we will discuss shortly. So the liver is removed to show you that this is the left lobe of the liver, and on the right side the huge one is the right lobe of the liver. The right lobe is separated from the left lobe by the falciform ligament. Nothing but the parietal peritoneum getting reflected from the diaphragm and along the anterior surface of the liver to till that umbilicus. Let us discuss that one shortly. That is the inferior margin of the liver, the short margin. Beyond the inferior margin, that green colored structure is the gallbladder. The fundus of the gallbladder is projecting beyond the inferior margin of the liver. So that is the gallbladder, the green colored structures. So you are looking at that's the gallbladder, green colored structure, arrow indicating the green colored structure, and the next one arrow indicating structure is the IBC. Yeah, this is the falciform ligament. It has the two layers, right layer and the left layer. In between the two layer, in the bottom, the rounded cord-like structure, that is the ligamentum teres, that is exactly located in the depression, say the hepatic notch. This is the falciform ligament. It is attached along the anterior surface of the liver, and it is extending downwards, attached along the anterior abdominal wall till the umbilicus. So it has two layers, the right layer and the left layer. On the bottom, the round cord-like structure, that is the ligamentum teres hepatis. So that is the falciform ligament separating the right and the left lobe of the liver. See this falciform ligament. It is firmly adherent to that anterior surface of the liver. So on the right side it is reflected over the visceral peritoneum of the right lobe of the liver. On the left side it is continuous with the visceral peritoneum of the left lobe of the liver. Above we see that it is firmly attached to the abdominal surface of the diaphragm. Say that the parietal peritoneum getting reflected from the diaphragm and along the anterior surface of the liver. So when the parietal peritoneum getting reflected from the diaphragm to the liver, where it is forming the coronary ligament. Of course, what you are seeing is the falciform ligament only, separating anatomically, dividing the right lobe and the left lobe of the liver. Now this is the right surface of the liver, that my fingers hand in the right surface of the liver. This the liver has been removed, and show that parietal peritoneum getting reflected from the diaphragm to the liver on the posterior surface, forming the bare area of the liver. So bare area where the liver is devoid of peritoneum, the visceral peritoneum, because the parietal peritoneum getting reflected over this is the posterior surface of the liver, where it is does not cover the liver as a visceral peritoneum. That's why it's called the bare area of the liver. That is some of the bare area. See the groove for the IVC. This arrow indicating that right and left triangular ligaments. This is the parietal peritoneum getting reflected from the diaphragm to the liver, forming the right triangular ligament, and on the left side the left triangular ligament. Nothing but that the parietal peritoneum getting reflected from the diaphragm to the liver in the form of triangle shape. So that ligament is coronal ligament. On the right lobe we have superior and inferior lobe of the inferior layer of the coronal ligament. So that is nothing but the attachment of the lesser omentum, say the hepatogastroduodenal ligament, and that is the porta hepatis, where all the three structures, the portal vein, hepatic artery and bile duct is there. This is the lesser omentum, okay, the lower part being called its hepatoduodenal ligament. The upper part is the hepatogastric ligament. Together we call it as a hepatogastroduodenal ligament. We are indicating that is the structure related in the visceral surface of the liver, say the IVC. The IVC receiving the hepatic opening, that's a gallbladder. This is the porta hepatis, where the portal vein, bile hepatic duct, and the portal vein is there. Close views, you can see the right and middle and left hepatic vein which is opening into the IVC. That will gives the support to the liver. See, that is the caudate lobe of the liver, and it is extending along. There is a small process, caudate process, to the right lobe of the liver. That is nothing but that is the fissure. There is a fissure for the ligamentum venosum. The upper part, the groove for IVC. Here is the, in the lower part, that in the groove, the ligamentum teres hepatis is there. This is the ligamentum venosum, the groove for the ligamentum venosum. So together the groove for the ligamentum venosum, the fissure for the ligamentum teres, and the falciform ligament divide the liver into right and left lobe anatomically. That is the left lobe of the liver. On the right side, right lobe of the liver. So that is the groove. The deep one is the groove for IVC. That's the right lobe of the liver. That is the quadrate lobe. That is the quadrate lobe. Just beneath that, below that, that is the gallbladder. This is the caudate lobe, and that is the caudate process, continuous with the right lobe. That is the anterior surface of the liver. This is to give an outline about that pancreatic duct and the bile duct. So that is they are indicating the pancreas, its head, the neck, body and the tail. The head is located within the concavity of the duodenum, and the neck, body and tail is attached to the spleen, and the pancreas is running horizontally a little bit upwards towards the left, and the middle, the body is related to the L1 vertebra, and on the right side IVC, and this is the aorta with the origin of the superior mesenteric artery, and the last one is the kidney, the left kidney. So this is the small projection from the head of the pancreas, that is the uncinate process, and this is the neck of the pancreas where the portal vein is related. This here you can see the pancreatic duct. See the main pancreatic, that dotted line, circular line indicating the pancreatic duct. The pancreatic duct join with the bile duct and to open into the second part of the duodenum. Let us see the bile duct system. That is the portal vein, the hepatic artery and the hepatic duct. That is the three structures encountered in the porta hepatis. So the arrow indicating the right and left hepatic ducts. Right hepatic draining from the right lobe and the left from the left lobe. They both unite to form the common hepatic duct. What happens? This common hepatic duct receives the cystic duct. cystic duct is coming from the gallbladder. See, close to the neck of the gallbladder, the cystic duct is emerging, and the cystic duct joins with the common hepatic duct to form the common bile duct. Now this common bile duct joins with the pancreatic duct, then it is going to form the common hepatopancreatic duct. It is open into the second part of the duodenum. Look into the gallbladder, the parts. See that the part of the gallbladder which is projecting beyond the inferior margin of the liver is the fundus, and that remaining portion is the body, and close to the cystic duct is the neck of the gallbladder. It is covered with the inferior surface is covered with the visceral peritoneum, and the deep surface is not covered with peritoneum. That is one of the barrier of the liver, the fossa of the gallbladder. So the part of the liver has been removed, left lobe of the liver has been removed, and the transverse colon also removed, to see the structures in the porta hepatis. So that is the lesser omentum, and the right free margin of the lesser omentum is there. The lower part of the lesser omentum, that is the hepatoduodenal ligament, there is a site for that is the porta hepatis. Underneath that is the epiphytic foramen, that is the hepatoduodenal ligament. That is the bile duct, the common bile duct is going to open into the second part of the duodenum. See, that is the duodenum. See that posteromedial aspect of the duodenum there, the common bile duct is going to open after joining with the pancreatic duct, main pancreatic duct. So that is the main feature in the second part of the duodenum in the interior. See that second part of the duodenum is cut open to show you the opening of the common bile duct, and that is the arrow indicating the common bile duct. That is the main pancreatic duct. That one is the accessory pancreatic duct. Look at this, the opening of the main pancreatic duct, the duct of Wirsung. See, that is the area where it is opening into the major duodenal papillae. See the opening of that major duodenal papillae. Now let us see discuss the blood supply of the liver. The liver has a dual blood supply. The portal vein, 70% of blood supply by the portal vein, and 25% by the hepatic artery. So the highlighted areas are the stomach and the porta hepatis. Now that is the lesser omentum has been removed to show you the celiac trunk, and that is the esophageal end, opening of the cardiac end continues with the stomach. So this is the right and the left crest of the diaphragm. Beneath that you can see the abdominal aorta giving the celiac trunk, also called the tripod of Haller, tripod. So remember that three branches, the left gastric artery, and the common hepatic and the splenic artery. The arrow indicating that the first branch from the abdominal aorta, the inferior chronic artery, and this is the branch from the celiac trunk, that is the left gastric artery. See that, and towards the right common hepatic artery, and towards the left is the splenic artery. Splenic artery is being the largest one, and its tortuous course running along the upper border of the pancreas to reach the spleen, mainly going to supply the spleen. That is the pancreas, they are indicating the spleen. So the upper abdominal organs are supplied by the artery of the foregut, say the celiac trunk. See the common hepatic artery. It is the common hepatic artery going to divide into a proper hepatic artery and gastroduodenal artery. That is a proper hepatic artery going to divide into right and left hepatic arteries to supply the entire liver. That is the cystic artery is coming from the right hepatic artery going to supply the gallbladder. This is the hepatic artery is going to divide into, that is a hepatic artery, into right hepatic and the left hepatic artery to supply the right and left lobe of the liver. That is portal vein. That 75% of blood supply by the portal vein, 25% contributed by the common hepatic artery. Look at the common hepatic artery is going to divide into a proper hepatic artery, and proper hepatic artery is giving the right gastric artery. This is the gastro-duodenal artery is going to give two branches, the right gastroepiphytic artery and pancreatico-duodenal artery. Pancreatico-duodenal artery supply the pancreas and the duodenum. The right gastroepiphytic artery is going to supply the stomach along the greater curvature. This is the cut end of the common bile duct. See, the branches from the common hepatic artery is going to supply the stomach. Let us see the right gastroepiphytic artery is a branch from the gastroduodenal artery running along the greater curvature of the stomach. This is the left gastric artery anastomosing with the right gastric artery coming from the proper hepatic artery. The anastomose is located along the lesser curvature. That is the left gastric artery anastomosing with the right gastric artery. This is gastroepiphytic artery. Right